Good afternoon. I'm here to talk about NHS equality or inequality as an insider working in the National Health Service. The first question people are always considering is whether it actually exists or not. That is, whether people living in different parts of the country can have a different level of health care and thereby have different levels of survival from cancer or heart disease. And the reality is it does exist. There's actually a government department dedicated to reducing health inequality, which people may or may not be aware, but it is actually a very strong department, which actually a very strong purpose. So the purpose of the government department is to reduce health inequality so that people can have access to a better standard of care throughout the country. The King's Fund has actually devised certain parameters that they want to measure across the country, which will be able to define the various levels of quality of healthcare across the country. Thereby people can compare and then they can access certain services. Okay. Now that we know that health equality or health inequality does exist within the United Kingdom, we now need to consider whether patients really have choice in this matter. Do patients have access to real-time data that says that if they live in certain areas with certain clinical conditions, their chances of survival, the chances of improvement are actually quite higher? Is this data readily available? Is there real patient choice? So if certain patients have certain types of cancer, do they have better survival and mortality and morbidity data in different parts? Ideally, if you're a patient living in a part where there is high mortality from certain conditions, you might want to have access to better services from another part of the country, if you can move, that is. And that is where I see the real patient choice is coming from. And I really don't see that patient choice exists in that context, whereby GPs do not say these certain types of services are better available in different parts of the country. We might try to access the services from different parts of the country. The third point to consider is, can more money fix it? I.e., if the NHS invests more money in this, will it fix it? Will we be able to broaden out the inequality so that services are more equal? Or will it have the opposite effect, whereby the services that are actually providing excellent care are actually dumbed down to provide a similar type of care to other centers which are not to that high standard? And the short answer is no, because it's just money does not solve everything. We need a combination of money as well as motivation, as well as really empowered staff to be able to achieve a wider social and health-related social agenda. This does raise significant ethical issues for our services, because patients will not be told that certain services are available better in different parts of the country, and they will feel that there are no other options. Now that we know that health inequality exists and that patients do not have full informed choice and that money won't fix it, we're now in a situation where it raises significant ethical issues for patients, for the frontline healthcare staff, as well as the services. It is quite possible that patients will be told that there are no treatment options available for them, when in fact, with a little bit of investigation, they should be able to find an accessible NHS service a bit further away that may be able to answer some of the questions that have been raised by the patient. It is quite possible that patients will be told that there are no treatment options available, when with a little bit of investigation, they would be able to access a service a bit further away from their home, which will provide a completely different level of care. And this is what is important for people to consider in a broader context. The ethical implications of this are huge, because patients will not know, and patients will be making choices on the basis of wrong information. Patients will not be aware that there are better treatment options available a bit further away, and this will have a big implications to themselves as well as their families, because it is quite possible that patients would be willing to travel further to access a better level of service if they only knew about it. So within this context of an extremely divided National Health Service, how do staff keep motivating themselves so that they are able to still provide an excellent level of care to their patients? And this is the challenge for the NHS, to maintain the motivation of the young staff who are coming in from different disciplines, from the medical, from the nursing, from the allied health professionals, who are all striving to provide excellent health care. And they need to motivate themselves first before they can provide an excellent level of care. And if they are themselves aware of this health inequality, how does that affect their morale? And does that cause a bigger problem to address a bit later on? In my opinion, this needs to be considered as a human resource matter that needs to be considered in every staff development program, because if people become more demoralized because of the health inequality, then it can actually further fragment the NHS in terms of the care it provides. So what's new about what I'm talking about? This much information everybody knows and everybody is aware. They might not be shouting on the top of rooftops, but everybody is aware of this level of, everybody who's working in the NHS is fully aware of this level of inequality. In my opinion, there are pockets of excellence within the NHS which need to be encouraged, nurtured and grown so that people can find themselves in a position where they are providing excellent care, they're able to motivate themselves and not dumb down services so that people are provided a standard of care that is really poor. There are various mechanisms, both local and regional, which identify these pockets of excellence, and certainly these are important factors for consideration, and we need to keep this level of motivation and recognition of these centers of excellence at a very high level so that people are able to keep motivating themselves. So who can do what? I think the NHS is a body that represents everybody. Everybody is equally responsible. It is easy for us to say managers haven't invested in our services, therefore we are not providing an excellent care, but we should actually motivate ourselves. We should push ourselves to provide the best that we can do. The funding issue is, in my view, secondary, because the NHS is a socialist service whereby it is meant to be free at the point of delivery, and that does involve a bit of equalizing across the society. The important factor is for patients to be fully aware. They need to be championing the centers of excellence. They need to be demanding more of the local services. They need to be demanding more access to the services that provide excellent care so that the other services will rise up to the challenge. And both staff as well as patients, by being better informed, better motivated, this provides one strand of attack so that we can reduce the health inequalities within the NHS.